Then it's possible you could have had hepatitis A also. It's possible you could have had hepatitis E as well. In fact, in our environment, we are meant to help them cut their nails. At times they use spirit and lighter to say they are disinfecting it, but at times this thing may not completely disinfect these viruses. So we always advise people to get their own individual manicure and pedicure sets. Toothbrushes may be surprising to some people. We know that when we use toothbrushes at times, when we brush our teeth, we may see some trace amount of blood. The brush may actually pierce the gum, just minute piercing, and that may leave some tiny microscopic blood stain on the toothbrush. And when another person uses that toothbrush, if it's already contaminated with hepatitis B or C or D, and that other person may get infection through sharing these toothbrushes. And body piercing, tattooing, sharing other sharps, all this may transmit the infection. Of note is also cultural practices. In Nigeria, we have some communities where they do mass circumcision. They line up children of the same age group, to circumcise them. And at times it could be a ceremony. And the person circumcising them use the same instruments all through for all the kids. Perhaps if one of them is infected with hepatitis B or C, it will just transmit the infection, to these other children. And also intravenous drug abuse. People that abuse drugs, they inject themselves. They have friends who inject themselves. They share these drugs. In the long run, they share syringes, needles and syringes, and they may end up transmitting this infection. Of course, sexual transmission is also a very important, sort of infection. And hospital infection is also possible. We always advise people to go to standard hospitals. In hospital where you are sure that their instruments will be properly sterilized, because contaminated instruments, could spread hepatitis. If it's being used for somebody with hepatitis, it's contaminated with the blood, not properly sterilized, it could spread it to the other people using the same instrument. Then blood and blood products, also very important. Blood products should be properly screened. Anybody having to receive blood transfusion or any blood products, it should be in a center where there will be proper screening, so that one does not get infected, with hepatitis. Then household contacts, for one reason or the other, household contacts may get infected, maybe through sharing sharps unknowingly or through skin abrasions, wounds and things like that. So usually once we see somebody with hepatitis B or C, we always advise that all the household contacts, should get screened, for the same, infection. Now, we mentioned earlier about the mother to child transmission and also transmission among children. This is important, because when children get infected in infancy, the risk of having a chronic long-term infection, is about 90%. And it's very important in our environment when we have mothers that are hepatitis B positive or unknowingly transmitting it to their newborns. You see such child growing into adult life with hepatitis. And the only way we can know at times is, some people may go back home and they find out their mother too has hepatitis B, or they find out that their siblings, born of the same mother also have hepatitis B. Then children about the age of 5 years, the risk of having a chronic long-term infection, is about 50 to 60%. So this is a very common mode of transmission in Africa, and it's part of the reason why we have a lot of chronic viral hepatitis, in Africa. Well, this is just to highlight some of the routes of transmission: tattooing, body piercing. People pierce virtually any part of their body now. Then people sharing IV drugs, blood transfusion, and even sharing toothbrushes. Now, we talked about, the route of transmission. Basically, it's the same for hepatitis B, C, and D. But when we look at hepatitis C, there's a lower risk of sexual transmission and also a lower risk of mother to infant transmission. Hardly do we ever see the husband and wife both having hepatitis C. Despite living and cohabiting together for a long time, it's rarely, transmitted sexually. And mother to infant transmission too is very rare for hepatitis C. So these are just some minor differences in the route of transmission of hepatitis B compared to C. Now, it's very important to know that hepatitis B is not transmitted by shaking hands, by hugging, by sharing clothes, or sharing office space, or sharing classrooms. We have some places where they do screening for maybe their office staff, and there may be some stigmatization. And say, so you go and get yourself treated before you come back to the office. No, sharing office space will not transmit it once you are not sharing sharps in the office. Children in the same school, once they are properly immunized and they are not sharing sharps, we don't expect, that there should be transmission within the classroom. So this should be properly understood in order to avoid any form of stigmatization, against people that have viral hepatitis. Now we go back to the acute viral hepatitis and chronic viral hepatitis. All the hepatitis viruses can cause acute infection, as we said earlier, resolving within weeks and not exceeding 6 months for complete recovery. And hepatitis B with or without D, and likewise hepatitis C, can cause chronic infection. Now, with acute infection, most times there are no symptoms, or people may just have mild, non-specific symptoms like headache, poor appetite, malaria, feeling unwell, joint aches, fever. Perhaps one of those days that someone had any of these symptoms, who knows, it might have been an acute viral hepatitis. Now, some people go on to develop yellow eyes that we call jaundice. And of course, when somebody develops yellow eyes, he rushes to the hospital, and that may raise the suspicion of viral hepatitis. So usually these are the few ones that we're able to make a diagnosis of, in the hospital when they develop jaundice. So we screen them for hepatitis A, B, C, and so on, and we may be able to detect that this person has an acute infection. Now, this just to summarize the possible, symptoms: jaundice, fever. Some may have dark urine, stool may become very pale and difficult to flush. Some may have nausea, vomiting. There may be pain in the right upper side of the abdomen where the liver is. Some may have joint pain, some may have a rash, headaches, weakness, and fatigue, and some may have loss of appetite. Now, acute infection usually does not require hospitalization. Rarely do we admit people for acute infection. Mainly we just do symptomatic care. We give fluids, we give multivitamins, we give pain relievers or antipyretics to reduce fever, and we always encourage people to take high-calorie diets. And we expect resolution within a few weeks or maximum 6 months. And risk of death from acute viral hepatitis is very low, lower than 1%. Some we even say lower than 0.3%. So it's very low. Now, when we look at chronic viral hepatitis, this is long-term infection with viral hepatitis caused by B with or without D and hepatitis C. And these are the major causes of liver diseases, liver cirrhosis, liver cancers, liver failure, and end-stage liver disease. When we talk about liver failure, any organ that we say has failed means that the organ is unable to perform its function. So you can imagine the numerous functions of the liver, and the liver now being unable to perform these functions. We can say that that's almost like a death sentence when there's a liver failure. Always very difficult to manage in the hospital. Now, major factors that determine if hepatitis B will resolve as an acute infection or go to the chronic stage is the age at which the person got infected. When people get infected in infancy, there's a very high chance that there will be a long-term infection. If somebody got infected as an adult, there's a very low chance, that there will be a long-term infection, as we see in subsequent slides. Now, for hepatitis C, almost all cases of hepatitis C, about 85% of cases of hepatitis C, progress to chronic infection, irrespective, of the age of acquisition. This just to show the viruses that cause chronic infection. And this just to highlight the fact that infants, up to 90% of them develop long-term infection, whereas adults, about 5 to 10% of adults develop long-term hepatitis B infection. For hepatitis C, whether infant or adults, the rule is almost always that there will be a long-term, infection. This also emphasizes the fact that the younger the person, the greater the risk of long-term infection, 90% in infancy, about 50% at the age of 1 to 5, and about 5%, in adulthood. Now, chronic hepatitis is regarded as a silent disease because the early stages are asymptomatic. People usually have no symptoms, so people don't even know they have the infection. The liver is often severely damaged, with cirrhosis or liver cancers before the patient becomes symptomatic, and that may be when the person goes to the hospital for checkups and becomes aware that it's actually, chronic viral hepatitis. Now, when we look at hepatitis B, we usually call this the silent killer. Worldwide, there's very high prevalence, or let me say high prevalence in sub-Saharan Africa, Far East Asia, some parts of South America, and the northernmost part, of North America. These are areas that have prevalence of more than 8%, of population having hepatitis B infection. And globally, about 2 billion people plus have been infected with hepatitis B. About 4 million acute cases occur each year, and about 1.3 million deaths are recorded per year due to hepatitis B. There are about 260 million individuals with chronic infections. And the sad thing is about 2/3 of those infected individuals are not even aware that they have hepatitis B infection, because some don't even know what hepatitis is, talk less of going to do the tests. Now, hepatitis B is the second most important carcinogen after tobacco. When we talk about causes of cancer, we know that tobacco is a very important cause of lung cancer. After tobacco, hepatitis B is the second most important cause, because about 60 to 80% of all primary liver cell cancers, are due to hepatitis B infection. So this is very important. And in Nigeria is among the countries with the highest viral hepatitis burden. The prevalence was, a survey showed that prevalence was 12.2%. That's about 27 million individuals, considering a population of about 220 million. Though a more recent survey put the prevalence at about 8.1%. And the hepatitis C prevalence was about 2.2%, with a more recent survey showing about 1.1%. And when we compare this to the HIV prevalence of 2.1%, I'm sure everybody knows about HIV. HIV is so popular, that people know almost everything about HIV. But when it comes to hepatitis B, which happens to even be more common than HIV, people don't know so much about hepatitis. Now, hepatitis B is 100 times more infectious than HIV and 10 times more infectious than hepatitis C. And it survives outside the body at room temperature for at least 7 days, and can still be infectious. HIV can barely survive a few hours. After that, it's not infectious again, once it's outside the human body. So when we have maybe needles, blades that are contaminated and they're inside the house, or they're somewhere and it gets contact with our bloodstream, maybe by having accidental injuries or using, used razor blades, up to 7 days after, this can still transmit hepatitis B, and of course, even hepatitis C. Now, when we look at hepatitis B progression to complications, not everybody with hepatitis B is bound to have a liver cancer or have a liver failure or liver cirrhosis. About 15 to 40% of those, with chronic hepatitis B may progress to these complications of liver cancers, cirrhosis, and failure. And the thing about hepatitis B is that at times, within a short period of time, 5 years or even less at times, it may cause a liver cancer. It may cause a liver cirrhosis. It may lead to a liver failure. And all this, the only curative treatment for these complications is to have liver transplantation. Unfortunately, in Nigeria, we don't have any single center that can do a liver transplantation. So when we see people with these complications, we try to manage prolonged life as long as possible. But in as much as liver transplantation is not done, it's more or less, a death sentence, unfortunately. Now, we look at hepatitis C. We call it the slow killer. And we call it slow killer because it takes about 20 to 30 years before it causes any significant damage, to the liver. And when we look at the world map, Nigeria also falls into the region of very high prevalence. This map shows a prevalence of more than 2.9%. Though we know that the studies quoted earlier was about 2.2%. But just tell that, worldwide, we also belong to a region where hepatitis C is highly prevalent. Now, looking at the natural progression, we said earlier that when people have hepatitis C infection in the acute phase, only about 15%, completely resolves. The remaining 85% will have a chronic long-term infection. But not all these 85% are bound to have cirrhosis. Just about 20% of them may develop liver cirrhosis, and about 6% per year may develop what we call liver failure or end-stage liver disease, and about 4% may develop hepatocellular carcinoma, that's developing liver cancer. That's about 4% per year. And all this may take about 20 to 30 years before, liver failure, cirrhosis, or hepatocellular carcinoma develops. Though people that have hepatitis C infection and at the same time have HIV infection, the progression tends to be faster. People that have hepatitis C and also have hepatitis B, or they have hepatitis C and they consume